Okay, I think it's 3 minutes after the time, so we can go and get started. Hi, everyone. Welcome to the Lunch and Learn event organized by ATSDR, Office of Community Health and Hazard Assessment, or we call it OCHA. My name is Jane Lee, and I'm OCHA's Associate Director for Science. I'm also the host and organizer for this event series. So before we start, just a couple of housekeeping items. First, this webinar is recorded, and we plan to release a recording to the public. Therefore, all audience are muted during the presentation. If you have questions, please feel free to type in the chat box throughout the whole course of the presentation and the demo. At the end of our demo, our presenters will answer all the questions received in the chat box. After that, if we still have time, we can open up the mic and enable live Q&A. So if you have a question at that time, we will prompt you to raise your hand on Zoom, and then we can unmute and you yourself unmute to ask a question live. So for today's Lunch and Learn, as you know, ATSGR as well as state partners conducts public health assessment to investigate exposure, evaluate potential health effects, and develop public health actions, as well as recommendations for communities. This process has become increasingly challenging because of complex sites, multiple exposure routes and pathways, emerging contaminants, and evolving knowledge on chemicals and their toxicities. Therefore, to guide the public health assessment process, ATSDR has developed several foundational tools and the guidance to really help guide all the health assessors through the whole process. And that includes the main topic for today, as well as the next few webinars, which is our Public Health Assessment Site Tool, or we call it PHAST, as well as Public Health Assessment Guidance Manual, or PHAGM. So today kicks off a training series focusing on new and updates in these tools and guidance. So without giving up too much, I'm going to hand over my virtual microphone to Dr. Greg Urich from our ADS team and have him take over from here. Greg, it's all yours.
Thank you, Jane. Yes, and good afternoon and welcome everyone to the first of the series of webinars relating to several new guidance documents and tools that ATSGR is releasing in 2022. As Jane mentioned, my name is Greg Urich, and I'm one of the ADSs in the ADS office under Jane. The new guidance released includes our web-based public health assessment guidance manual, exposure point concentration guidance for non-discrete sampling, and calculating benzoate pyrene equivalents for polycyclic aromatic hydrocarbons, or PAHs. ATSGR will also be releasing version 3.0 of the shower model and the new ATSDR exposure point concentration tool. PHAST has been updated to include a new air pathway and will be updated with a new module for integrating the shower module results into PHAST. This training series is designed to familiarize health assessors with ATSGR's new guidance and tools as they are released. Today, we focus on demonstrating the new features in PHAST to assess health assessors in evaluating air exposures under different scenarios. It's important to note that the new PHAST Air module is based on the final 2020 Guidance for Inhalation Exposures, which was authored by Dr. Michelle College from ATSGR's Region 5 office. We appreciate her efforts in developing this complex guidance and working with ATSGR PHAST team to develop this new air module. I also want to thank Michelle Arbogast from ERG, who will be presenting this demo today, and others from ERG, Eastern Research Group, who helped us to get this new module launched. Finally, if you have not already registered, please do so for other webinars in this series as you see on the slide. However, these webinars will be recorded, as this one is, as Jane mentioned, and posted for viewing if you cannot attend a specific live training session. Thanks for attending, and we hope you enjoy the webinar. Michelle?
Good afternoon. My name is Michelle Arbogast. I work for ERG, a contractor for ATSDR. I'll provide a brief overview of PHAST and then spend the remainder of this webinar demonstrating how to use the new air exposure calculator. What is PHAST? PHAST stands for Public Health Assessment Site Tool. It is a web-based application built to assist ATSDR and partner health assessors evaluate environmental data and perform complex dose, hazard quotient, and cancer risk calculations. ATSDR created PHAST to promote efficiency and consistency in the public health assessment process. The key features of PHAST include the Site Information and Data module, which allows for entry of site information and import of data sets. The Comparison Value Screen, also known as the CV Screen module, screens environmental data against comparison values to identify media-specific concentrations that require further evaluation. PHAST currently screens water, air, soil and sediment, and soil vapor intrusion data. The Exposure Calculator module calculates exposure doses or concentrations, hazard quotients, and cancer risks for drinking water, surface water, soil and sediment, food, and now air. The CVs and Health Guidelines module houses the most current ATSDR CVs and health guidelines. The My Saved Results module provides access to saved scenarios and data imports. Several versions of PHAST were released in the last 5 years. PHAST was first released in April 2017. All the current modules were live except for the CVs and Health Guidelines module, which went live with version 1.3 in 2019. The original CV Screen module could screen water, soil, and air data. Screening soil vapor intrusion data was added with version 1.3 in 2019. The original dose calculator calculated exposures from drinking water, soil and sediment, and liquid and solid food. Exposure to surface water was added with version 1.4 in 2019. And the air exposure calculator was added with version 2.0 earlier this year. Several user enhancements, such as 508 compliant word exports, have been added along the way. There was not a version 1.9. ATSDR added several new features and enhancements in version 2.0. The most significant new feature is the air exposure calculator. Users have the option to choose from 5 different exposure scenarios: residential, daycare, school, occupational, and visitor. ATSDR added a school scenario to respond to a request from a partner health assessor at the New Jersey Department of Health. Because doses are not calculated for the air pathway, we renamed the dose calculator the exposure calculator. We changed concentration to exposure point concentration to be consistent with ATSDR's new EPC guidance. Because the air pathway results can be displayed in either micrograms per meter cubed or parts per billion, PHAST now displays the inhalation unit risk in both units. We also added a new contaminant categories and properties file that downloads all the contaminant categories and properties, such as molecular weights. This new resource can be found in the CVs and Health Guidelines module, on the resources page, and in each exposure pathways help menu. We updated all the links to ATSDR's toxicological profiles. We added flags to the CV Screen module for contaminants that at least one organization has classified as carcinogenic. However, no cancer risk evaluation guide is available. We made the data import validation easier to use by allowing incorrectly spelled contaminants to open in PHAST with the opportunity to fix them. PHAST now also includes the contaminant name and CAS registry number in the red validation box when an error occurs during data import. More information is available in a detailed user guide posted in the PHAST resources. Please email the help desk at fast@cdc.gov to request access to PHAST. You can also email questions or comments to the help desk. The remainder of this webinar will focus on the new air pathway that is included in PHAST version 2.0. For that, I will now switch to the tool itself. This is the PHAST homepage. It provides quick access to all the PHAST modules. To find the air exposure calculator from the homepage, click on the exposure calculator button in the lower left, and then in the pop-up, click on inhalation in the air group. Note that the dose calculator has been renamed exposure calculator because air exposures are evaluated with an exposure concentration instead of a dose. The air inhalation pathway calculates default and site-specific adjusted exposure point concentrations, hazard quotients, and cancer risks. You can also get to the air pathway by clicking the air inhalation option under the exposure calculator tab. The exposure calculator tab is one of several that are located at the top of every screen. Click on the blue question mark in the upper right for the help menu, which is customized for the air pathway. The user guide has been updated to provide guidance for this new pathway. This is one place you can find the new contaminant categories and properties resource. It also contains a link to the guidance for inhalation exposures, which is also on the resources page. Click on the blue plus sign under the question mark to show the equations for the air pathway. A dose is not calculated for the air pathway. Instead, the exposure point concentration, or EPC, is multiplied by an exposure factor to calculate an adjusted EPC. Now let's delve into the air pathway. The contaminant information page looks like all the others, including an option to run a quick summary with default exposure parameters for a residential scenario. I begin by entering Ben for benzene. Next, I'll enter 20 in the EPC field and choose micrograms per meter cubed in the unit field. I'll select 95% UCL of the mean as the type. And now if I click add another contaminant in the lower left, I can add chloroform at 5 micrograms per meter cubed, and I'll select 95% UCL of the mean. If I click this blue Run Quick Summary button, PHAST will generate default results for the residential scenario. As with the other exposure calculator pathways, the quick summary will show you whether your contaminant concentrations are high enough to generate hazard quotients greater than 1 or cancer risks above 1 × 10⁻⁶. The exceeded values are shaded, and the notes tell me to review concentrations and hazard quotients for each age group, as well as the cancer risks. Clicking on the Show Default Residential Results button above the quick summary will open chronic, intermediate, and acute results tables. You'll notice that all the adjusted EPCs are the same for each exposure group. This is because the default exposure factor for a residential scenario is 1 for all exposure groups. As with other pathways, you can click on an adjusted EPC, hazard quotient, or cancer risk in the table to display the populated formula used to calculate each value. One of the special features of the air pathway is the ability to display your results in either micrograms per meter cubed or ppb. You can select either unit for each contaminant. You do this by clicking on the drop-down arrow to the right of the unit in the Adjusted EPC column to switch units. All the values in the contaminant row and the adjusted EPC for all durations will be automatically converted to the selected unit. If you change the unit in one duration, PHAST will change it for all durations. As with all other exposure calculator pathways, hazard quotients greater than 1 and cancer risk greater than 1 × 10⁻⁶ are highlighted orange and contain a footnote. After running the quick summary, you can save the scenario in PHAST, download your results to Word or CSV, and enter site-specific parameters. When you download the results, you have the option to include the adjusted EPC in both units or in the on-screen selected units. I am now going to click the blue Enter Site-Specific Parameters button in the lower right so that I can show you the exposure scenario options available for the air pathway. We are now on the exposure groups page. users have the option to evaluate 5 different exposure scenarios, which are displayed near the top of each page. Each scenario has unique exposure factors on the next screen. Click on the scenario name to select that scenario. Each scenario has the option to add 1 or more custom groups. The residential scenario contains the standard exposure groups: birth to less than 1 year, 1 to less than 2 years, 2 to less than 6 years, 6 to less than 11 years, 11 to less than 16 years, 16 to less than 21 years, and adults. The daycare scenario contains the first 3 standard exposure groups, which represent the ages at which children could be in daycare. Full-time and part-time workers are also included. The school scenario is the most unique. The exposure groups are by grade level, starting with pre-K, kindergarten, elementary school, middle school, and high school. Full-time educators and workers are also included. Note that there is not an option to select all exposure groups, unlike for the other scenarios. This is because it is not likely that a person would be exposed from pre-K all the way through high school. For example, if you have exposures in a school that contains grades 1 through 8, you would only select the elementary and middle school grade levels and the appropriate educators and workers. Educators and workers have different exposure factors. The occupational scenario contains full-time and part-time workers. Notice that for this scenario, you have the option to enter exposure factors or calculate default results. If you click the blue Calculate Default Results in the lower right, PHAST will go straight to the results page and display results for the occupational scenario using default input parameters from ATSDR's guidance for inhalation exposures. This is the only scenario with the option to skip the exposure factors page. But I'll go over the results later. So I'll click on the Exposure Groups tab to go back to the exposure groups. The visitor scenario contains the same standard exposure groups as the residential scenario. The exposure factors page for each scenario is unique. I will now show you each one. I'll start with residential by clicking the residential scenario, selecting all the exposure groups, and clicking the blue Enter Exposure Factors button in the lower right. This page should look familiar. It is the same exposure factors page as the other pathways. The exposure factors that calculate an EF of 1 are pre-populated. If you have exposures for a year or longer, you have to enter the total years of exposure for your chronic scenario. If you have exposures of less than a year, choose intermediate or acute and enter the appropriate exposure factors. You click the blue Calculate Results button in the lower right when done. Next, I'll show you the daycare scenario by clicking the Exposure Groups tab, selecting the daycare scenario above the table, selecting all the exposure groups, and clicking the blue Enter Exposure Factors button in the lower right. This is where things become unique. You'll notice at the top of the screen, you have the choice of evaluating chronic, intermediate, or acute durations. If you select intermediate and acute scenarios only the relevant fields are displayed. The total years of exposure field and exposure duration column in the table are no longer available because exposures are for less than 1 year. Similar adjustments are made when you select acute scenario only. Only the daily hours per day field is displayed. So let's go back to evaluating a chronic scenario. So I can show you all the fields and how this page works. After selecting between chronic, intermediate, and acute durations, you'll next select your exposure options. You have 3 exposure options above the table. If you have all site-specific exposure factors for your scenario, select the first radio button to use site-specific exposure factors and site-specific exposure durations. Then enter a value in the total years of exposure field. For this, I'll enter 15. Notice that FAST automatically populates the site-specific exposure duration column in the table below. You would then enter hours per day for daily, days per week for weekly, and weeks per year for annually for each exposure group in the site-specific columns. Select the second radio button to use all default CTE and RME daily, weekly, and annual exposure factors and default exposure durations. After selecting this option, all the open fields on this page are grayed out and unavailable. You do not need to enter anything else on this page. FAST will use the CTE and RME values displayed in the table to calculate exposure group specific EFs. Select the third radio button to use default CTE and RME daily, weekly, and annually exposure factors, but enter site-specific exposure durations. When this option is selected, you have to enter your total years of exposure in the blue field. Again, I'll enter 15. And when I click out of the field, the exposure durations automatically populate in the table below. You do not need to enter anything else on this page. After you have selected and entered your site-specific exposure factors, click the blue Calculate Results button in the lower right to generate results. Next, I'll show you the school scenario. I select the school scenario above the table. For this demonstration, I'm going to assume my exposures occurred in a high school. So I'm only going to select high school grade level and the appropriate full-time and part-time educators and workers. And I click the blue Enter Exposure Factors button in the lower right to proceed. The school scenario exposure factors page works the same as the daycare scenario exposure factors page. First, you select your duration, then select the appropriate exposure options. For this scenario, I'll select intermediate and acute scenarios only. I now only have 2 exposure options. If you select the first option to use site-specific exposure factors, enter exposure parameters in the site-specific fields in the table. If you select the second option to use default CTE and RME daily and weekly exposure factors, the fields are grayed out and you do not have to enter anything else on the page. FAST will use the CTE and RME values displayed in the table to calculate exposure group specific EFs. When you're done, click the blue Calculate Results button in the lower right to generate results. Next, I'll show you the occupational scenario by clicking on the occupational scenario and selecting both exposure groups. I'm also going to enter a custom group by clicking the Add Custom Group button on the right. I then need to enter a name for my exposure group. I'm going to enter workaholic and a duration of 50 years. Notice that you no longer have the option to calculate default results when a custom group is entered. Now I'll click the blue Enter Exposure Factors button in the lower right. This page is similar to the daycare and school scenarios exposure factors pages. It is divided into 2 sections, your duration options and exposure options. However, it does not have a blue total years of exposure field to the right of the duration options. Site-specific exposure durations are entered directly in the site-specific fields in the table. Note that the custom group exposure duration is populated with information entered on the previous page. I want to point out that no matter which exposure option you choose, the custom group's daily, weekly, and annually fields are never grayed out. This is because you must always enter site-specific exposure factors for a custom group. When you have entered all required fields, click the blue Calculate Results button in the lower right to generate results. FAST will not allow you to calculate results if any required fields are incomplete. For example, if I select this middle exposure option to use all default parameters, but I forget to fill in my custom group, FAST will highlight the missing fields and display a red validation note when I click Calculate Results. Finally, I'll show you the visitor scenario. I select the visitor scenario above the table, select all the exposure groups, and click Enter Exposure Factor button in the lower right. The visitor scenario exposure factors page works the same as the residential scenario exposure factors page. The only difference is that there are no default exposure factors for the visitor scenario. After you've entered your site-specific exposure factors, click the blue Calculate Results button in the lower right to generate results. Next, I want to show you the results page. I have a saved scenario to show you. I get there by clicking on My Saved Results in the upper right and choosing Saved Scenarios below it on the left. I'm going to open Daycare SS Scenario by clicking on the blue scenario name in the third column of the table. All right. Almost everything about the results page is consistent with all the other exposure calculator pathways. The results are displayed in tables that have site-specific side on the left and a default side on the right when applicable. Results for chronic exposures are followed by intermediate and then acute. The most notable unique feature is the ability to display results in either micrograms per meter cubed or parts per billion. Users have the flexibility to choose different units for each contaminant. When a unit is selected in one duration, it will be applied to that contaminant for all durations. As with all the exposure pathways, you can save your scenario in PHAST and download your results. You have the option to download 508 compliant results in both units or selected units. If I click the blue Download Results button in the lower left and keep the default of both units selected, then I click the 508 compliant button in the pop-up. This will download a Word file. Once the file has downloaded, click the file at the bottom of the screen to open the document. Click Yes to update the fields in the document. This is what creates the automatic table of contents. The downloads are set up the same as the other pathways. Control-click on benzene in the table of contents to jump to that table. Notice that there are two adjusted EPC columns, one for micrograms per meter cubed and one for parts per billion. Now I'll go back to PHAST and show you a download with selected units. Note that benzene is being displayed in parts per billion and chloroform is being displayed in micrograms per meter cubed. Now when I click on the download results button and change the option to selected units, then I click the 508 compliant button. As before, I'll click the file at the bottom of the screen to open the document and click Yes to generate the table of contents. Now when I control-click on benzene, you'll see that we only have one adjusted EPC column with the units in parts per billion. If we scroll to the next table, for chloroform, there is also just one adjusted EPC column with the units in micrograms per meter cubed. These units match what was selected on screen in PHAST. I'll now return to PHAST. The next slightly different feature to point out for air is the non-cancer exposure factors table. To view this, click on the blue Show Input Parameters button above the tables. If you recall, this table is usually not presented by exposure group. However, for the air pathway, the exposure groups can have different exposure factors for the daycare, school, and occupational scenarios. You can click on each underlined value to display the populated EF formula. This leads to one other important thing to note about the air pathway. There is a note about these exposure factors not being applicable for a few special contaminants. Acetone, ammonia, 2-butanone, chloroform, formaldehyde, hydrogen sulfide, and sulfur dioxide have exceptions for the standard EF adjustment due to the inherent toxicity of each contaminant. The file called Air Inhalation Pathway Exceptions for Exposure Factor Adjustment explains this. The note under the non-cancer exposure factors table has a link to the file. This note only displays when one of the 7 special air contaminants is entered. If you click on the blue file name, the file will download. A table on page 2 summarizes whether the standard EF adjustment is used or an EF of 1 is used. The good news is that PHAST automatically calculates the correct EF for each of these 7 contaminants. If we go back to the PHAST results, you can see which EF is being used in your results by clicking the adjusted EPC in the results table. For example, if I click on the adjusted EPC for a full-time worker exposed to benzene, you can see that the EPC is multiplied by 0.23. If I click on the adjusted EPC for a full-time worker exposed to chloroform, you can see that the EPC is multiplied by an EF of 1. The final topic for this training is data import. You get to that module by clicking on the Site Info and Data tab at the top and selecting Site Data. You start by selecting your site, and then you choose a file to import. Click Open and click Import. One quick note, we made a few changes to the data import validation for all media. If you have incorrectly spelled contaminant in your Excel data file, the table will open in PHAST and you'll be given the opportunity to fix the issue in PHAST. It would look something like the red benzene box. PHAST now also includes both the entered contaminant name and CAS registry number in that validation box to help you select the correct contaminant. Data import for the air pathway works the same as it always has, except that the Run Exposure Calculator button is now active for the air pathway. You can go directly to the air exposure calculator by clicking the blue Run Exposure Calculator button under the table. You can also run a CV screen first by clicking the blue Run CV Screen button under the table. With version 2.0, users now have the option to select contaminants and continue to the air exposure calculator by clicking the blue Continue to Exposure Calculator button under the table. And this now takes you to the air inhalation exposure calculator. Just a final reminder that PHAST has many resources to help you with your evaluations. We click on the Resources tab at the top to go to the Resources page. Under PHAST Resources is the PHAST User Guide, which has been updated to include the air pathway. Under Contaminant-Specific Guidance and Resources is the file with the air inhalation pathway exceptions for the exposure factor adjustment. And under ATSDR resources, we have the guidance for inhalation exposures. That concludes this demonstration of the new Air Pathway in PHAST version 2.0. We are happy to now answer any questions.
Thank you, Michelle, for the great demo, and thank you to Greg for the introduction. So we have received a few questions, and I'm going to read it out and send it to different panelists for answering. The first question that we received is, in the earlier ATSDR inhalation guidance dated 2020, the EPC used to be called adjusted air concentration, or ACC. Is this term ACC still valid to use? I think Greg, maybe you can answer this question.
Yeah, thanks, Jane, and thank you for the question. So we prefer to use the term adjusted EPC, and we have that as a common term not only in the air pathway, but in others. And so we'd like to use that in all certified documents, if you will. We will also check back in that 2020 document to see if that term is used there and not been substituted with the preferred term of adjusted EPC.
Great, thanks, Greg. The second question from Paul. His question is, how does your model address particulates, fumes, or vapors? Can you adjust for particle size? I think, Greg, maybe you can take this one too.
Sure. So this air module does not evaluate particulates. We have a separate guidance for particulates, and the data that you get should already have the type of particulate matter and the size of the particulate matter sampling that was done. Now, as everyone knows, that on occasion we get speciated particulate matter, which has various metals associated with it, or maybe others. And you may get specific metals that have MRLs where you could then evaluate it with the air module if there is an MRL that exists. And there was one example recently where there was a contaminant, I believe it might have been hexavalent chromium, I forget for sure, where there's actually two MRLs. One was based on particulate matter exposures, and one was based, I believe, on mists. And so we have two MRLs for that. And if you do get speciated data for a particular metal and there's an MRL, you can certainly evaluate it here or pick another screening value that you may have in the state.
Great, thanks, Greg. So the next question is from Franklin. Can we use a 508 compliant tables in our own health assessment documents? Greg, you want to take this one too?
Sure. Yes, I mean, the reason why we made them 508 compliant is that then you could use them as is in your documents. If you need to copy and paste the information there into other tables that you would then convert to 508 compliance, then you can do that too. I mean, sometimes the tables that we generate may not exactly fit with your needs as far as presenting the data and all, and you certainly can change that and just copy and paste the data. But yes, they are meant to be used directly in the documents if you would like.
Thank you. I think the next question is for Michelle. Do the Excel files need to be in a certain format to successfully import them into PHAST?
Yes, they do. In the site data module, there is a template. So data must be imported using the Excel template provided here. So if you click on this and download that template and use that to import your site data.
Great, thanks, Michelle. I think the next question probably is for David and Greg. So maybe David can give it a try. The question is from Teresa. What type of exposures are included in the air pathway? Does this include inhalation exposure from shower or bathing, other household water use? David, you want to answer it? Okay, David, you may need to unmute. Oh, yeah. David, you're still muted. Well, we can't hear you. Looks like you unmute yourself, but we can't hear you.
Is there a chance that you could put your answer in the chat box?
Oh, Greg, you want to answer when David's working out his
Sure.
document?
Yeah, I'll start it and David can add to it.
Yeah.
So currently, yes. So whatever, like for example, if you use the shower model to calculate a scenario, whether it's you know, for showering, and you also had showering and ingestion. Currently, you have to calculate your doses and your exposures separately. You could get the inhalation EPC from the shower model and put it into the air module that was just presented by Michelle. In the future, not too far in the future, actually, we also will be integrating the shower model into PHAST, in that you can import the results from the shower model into PHAST to do the kind of things I think that Teresa might be asking for here. And there'll be several scenarios. And also in the future, future update to PHAST, we will be developing shower model, drinking water combined CVs that will also then be part of PHAST. But in the interim, something that'll happen, as I mentioned to you on the slide that I talked about, there is a training session that will talk about the new shower model 3.0, and then also how that is then the results of the shower model can now be easily integrated into PHAST, and then you would run it through the air module. I believe that's correct, David or Michelle?
Can you hear me now?
Yes.
Yes.
Yay!
So please correct everything I just said, David.
No, you got it all right. You covered it all. The shower model version 3.0 is coming out the first week in May, and it has the ability to export results to a text file that you then import into PHAST, and then PHAST will do all these hazard quotient and cancer risk calculations for you from the shower model results.
I think the only thing I wanted to clarify is that you actually don't run your shower model results through the air pathway. There is a new module for the shower model to run your results from the shower model through. It's in gray here, but will soon be active.
Thank you for that clarification, Michelle.
Yeah. So stay tuned for the 2 segment webinars that are specifically focused on shower models. So I think lots of exciting updates coming up. Okay, so we go to the next question. I think it's a follow-up question from Paul. What about chemical difference in the inhaled species? There are issues with lung fluid solubilities. So Greg, you want to take this one?
Yeah, sure. I'm not a toxicologist, but I have played one on TV, so I may turn this over to David in a second. But
yes.
So as far as the air module is concerned, you know, this is after you, of course, screened in a contaminant, and you've adjusted if you need to adjust it. Of course, PHAST does that for you. You come out with your hazard quotient and your cancer risk if needed. But so the next step, of course, is to take a look at what that actual adjusted EPC means. Of course, if the HQ is greater than 1, you evaluate it. And the kind of things that you're talking about here in this question, issues of lung fluid solubilities and those kind of things, I believe the term is dosimetry. You would then want to look at those kind of things in your evaluation of whether you think harmful effects are possible or likely from the actual exposure concentration from the studies, or maybe other studies that are out there, the study that was based on the MRL or other studies. David, you want to add anything to that?
Yeah, I'll just add that PHAST gets you, and this is what Greg said, PHAST will get you to the adjusted exposure point concentration, and then you would have to apply your individual toxicology knowledge for that particular chemical and evaluating it further.
Thank you both. The next question is related to radon. Can the air module calculate doses for radon? Is there a specific model for radon? Michelle, you want to answer first? Oh, you're muted.
Sorry. Yeah, radon, the radiological contaminants are not in, I don't think they're in FAST.
There may be an MRL for radon, and if there is, then we could evaluate it. And of course, we wouldn't be calculating doses. It would be a concentration, unless I assume we were talking about air concentration for radon. If we have an MRL, we can evaluate it. If we don't, then we can't. I'm not too sure about radon.
Yeah, so we don't have, there's nothing listed for radon. So I think if you try to put radon in the air exposure calculator, you end up getting a note to talk to the SME.
Okay. So the next question from Jamie. Similarly, can the air module calculate doses for elemental mercury inhalation? Michelle, you want to take it first?
I'm sorry, I was still, this took a while to open.
Oh, that's
So
okay.
this is what happens if you try to enter radon in any of the dose calculator pathways. You get this note that basically you can't continue. And it's mostly a units thing with the coding. And anyway, can you please repeat that question since I was still.
Oh, I'm sorry. Yeah, so the next question will probably will be more straightforward. Can the air module calculate doses for elemental mercury inhalation?
Oops. So when you search for mercury, you have some choices here as to, you know, which CAS number you'd like, and you can choose the inorganic or the metallic. And over here is where it tells you whether we have CBs and health guidelines for which pathway. So for metallic mercury, we do have inhalation guidelines. So you can run metallic mercury through the air inhalation.
Great, thanks, Michelle.
Jane, one thing I'll point out is that the air module is not calculating doses. It is sticking strictly with concentrations.
It's a good clarification.
Yes, thank you. Yeah, that's right. So it's, you can assess concentration for mercury inhalation, but not doses. No. Okay, so we move to the next one from Somia. Will the TCE air pathway include a 3-week window of opportunity scenario for fetal heart malformations? Anyone want to take on this one?
This is Greg. I'll start. It doesn't specifically have any special coding for TCE, but when you do your exposure point concentration, and it is in the exposure point concentration guidance for discrete sampling, you have to take into consideration how you calculate and how you average your data. You would try to want to average your data in a time frame that's consistent with the time frame of the study, which you indicate for this one correctly, that a 3-week window of exposure, if you want to call it, or opportunity, as Somia puts it. That's the same with other contaminants. We talked about one of the special contaminants, which one of the ones that I've worked on, which is sulfur dioxide. That study is based off of exercising asthmatics for 5 to 10 minute duration. And that's what the MRL is based off of. So one would not want to average your data over 24 hours and then compare that, you're even to the maximum value, to the MRL, because you would likely not consider it not a problem when it could definitely be at a lower averaging time. So same kind of thing here. You have to be careful with what EPC you actually calculate, and that then should be matched with the window of exposure based on the toxicology of the particular contaminant and the way the MRL has been derived. David, do you want to add anything to that?
No, I think that covers it.
Thank you, Greg and David. So we do have to follow up the previous question on radar. We do have Paul, our radiation estimate on the line. And Paul, Zach, can you unmute Paul so that he can unmute himself and chime in more on the radar?
Sure. Paul, you should be, there we go.
Yeah, I guess you can hear me.
Yeah, I can hear you. Is that Paul?
All right,
Yeah.
the question about radon dose, calculating a dose is an issue that has not yet been accepted by the international committees that calculate radiation doses. They're just beginning to look at a radon dose to the lung. There's also been some discussions as to whether or not the inhalation of radon could increase the level or the rate of stomach cancer. And there's also been a paper that was just published within the last couple of weeks on radon concentrations and brain cancer. So it's still a topic that hasn't really been satisfactorily addressed yet. The best thing to really do is to just look at the concentration in the house where someone is living. And if it's greater than 4 picocuries per liter, which is about 15 becquerels per cubic meter, then something needs to be done. If you're outside and the concentration of radon is greater than 0.4 to 0.5 picocuries per liter, then you're a little bit above background. But other than that, there's really no way to do a dose calculation for radon for inhalation. And with respect to all the other radiologicals, the only radiological that's in PHAST is uranium, and that is only for uranium as a chemical contaminant and not for uranium as a radiological contaminant. And that's it for me.
Well, thank you, Paul. I'm glad that you are on here to help answer this question. Yeah, radiological assessment is definitely unique, quite different than the chemical related assessment. So thank you. We also have one last question received in the chat. Is a vapor intrusion module in the works? Greg, you want to answer this?
No, not to my knowledge. Of course, as maybe Franklin knows, that we do have soil vapor intrusion CVs. So that we do have that module there that then allows you to screen your contaminants and then go from there. So that option in PHAST is already there.
Yeah, Greg, I'll add to that in talking with Tanya, one of the reasons we haven't looked at developing a vapor intrusion model is that we don't use the Johnson-Ettinger model to predict indoor air concentrations. And so we don't use those results to make public health decisions. We use the vapor intrusion CVs that are in PHAST to decide whether or not to make recommendations about doing indoor air samples.
Yeah.
But we stop at that point.
So, but I think just to clarify too, so here within the soil vapor intrusion module, you can screen for your soil gas data and your groundwater data to determine the likelihood or potential, amongst other factors, of whether or not you may have soil vapor intrusion within a nearby building. But once you have your indoor data, then you would go to this air module to do the screening. And then, of course, you could have an occupational scenario. It could be soil vapor intrusion for a school scenario. It could be various ones, but you would use this air module once you have your exposure point concentration from the source being a soil vapor intrusion.
Thank you both. That concludes all of the questions that we received from the chat box. We are 2 minutes before our scheduled ending time. So I think we do have time for one final question live. So if any of you wants to ask a question live, please raise your hand using Zoom, and we can unmute you, and you can unmute yourself to answer question. So now is your time. Okay, well, I don't see a raised hand, but I do see another question coming up. Is there a module for assessing contaminant in shellfish or fish?
Yes. Yes, I'll take that. So ATSDR actually just recently named Lori Borbugi from our Region 10 office, I believe she's in Alaska, as our biota SME. And she and our also our senior rep out in Region 10, Rhonda Ketzel, is working on a fish and shellfish exposure dose guidance document. And then that would, once that's approved and all, that would then be used to inform, as analogous to here, where we use the guidance for inhalation exposures. We use that to inform the air module. We would use that other fish and shellfish EDG to inform the fish and biota module, which would be under the food module category, I believe.
Yep. Michelle, can you click on the food ingestion? Is that up? Yeah. Yeah, you can, there's a basic calculator in PHAST for entering chemicals, and if you want to enter one and just show them the next screen. Yeah, the one after that. Yeah, this is the basic calculator, but we've not put any defaults intake rates. And so we're looking at whether or not we can come up with default intake rates in the biota EDG that Lori is working on. So we have a basic calculator there that will get you a results table with hazard quotients and cancer risk, I think. But you have to decide what the intake rates are.
Good point. Thank you, David.
Yeah, thank you both. Okay, so I think we reached our time. Thank you all for coming, and we definitely want to thank our panelists, Greg and David, for providing the SME support, answer all questions that you sent. We want to thank Michelle for presenting and doing the demo, and we also want to thank Zach from ERG to work behind the scene to make sure everything goes smoothly as we can. And finally, thank you all for coming, and stay tuned. We hope you'll participate in the rest of the training series. 6 more to go. So go be on the lookout to your calendar invite or the reminders. Any questions, feel free to reach out to me. Thank you all. Have a great rest of the afternoon.